All right. So good morning, everybody. Thank you so much again for joining us this morning. My name is Amruta Nori-Sarma, and I'm an assistant professor in the Department of Environmental Health at Boston University School of Public Health. And I'm really excited for today's second in our series of CAFÉ University webinars, which is focused on extreme heat and health in India. And so I just wanted to start off by doing a very brief welcome. And of course, those of you who are joining us today probably are aware that we're currently facing very extreme heat conditions in South Asia. And I'm really thrilled that we're joined by Abhiyant Tiwari, who will be talking about climate and health in India and sharing some perspectives about development and implementation of different strategies to try and reduce the health effects of extreme heat exposures. But before we dive in, I just wanted to share some information about how you can connect with our CAFÉ, which is our Research Coordinating Center for Climate Change and Health, funded by the US National Institutes of Health, which has put together this webinar for today. Please feel free to join us for ongoing discussions and to learn about upcoming webinars in our series as we are continuing this set of educational initiatives focused on climate change and health in various parts of the world. So today's focus is going to be on extreme heat and health in India, as I mentioned. We've seen that this summer has already gotten off to a sweltering start, not just in India, but across South and Southeast Asia. As early as April, we were seeing record-breaking temperatures in various communities across South and Southeast Asia, including Myanmar. We've also seen issues in Malaysia. Power demand and electricity in order to provide air conditioning surged precipitously across Thailand. This is an example from the end of April. We've also been logging many cases of both extreme heat-related illnesses as well as mortalities across the region. And extreme heat impacts not just illness and mortality outcomes, but also has implications for structural issues, including changes to learning and school availability and opportunities for students across the region as well. So it's not just the acute impacts of extreme heat that we're interested in, but also some of the chronic issues that communities across the region might be facing as a result of these extreme temperatures. And these are not solo incidents. These are expected to be repeating across different summertime periods as well as into the future as climate change continues to exacerbate these conditions, both within the region of South and Southeast Asia as well as across the globe. And so this is more recent evidence from the region. These heat waves are ongoing and they're repeating exposures, including just from this morning, we've seen that New Delhi and parts of North India are under extreme heat alerts. And this is the second time that this is happening within this one summer period. So I'm really thrilled to turn over to my colleague, Abhiyant Tiwari, to talk about some of the implications of extreme heat in the region. So Abhiyant is the lead climate resilience and health consultant at NRDC India. His interest includes environmental, climate, and disaster risks to public health, and his work focuses on advancing evidence-based adaptation and mitigation policies and actions within these areas of interest. He has a lot of experience working with academia, governments, and nonprofits on public health research, program and policy development, as well as management and evaluation. Abhiyant and I have been friends for many years. We were very privileged to work together on the development and implementation of South Asia's first heat adaptation plan in the city of Ahmedabad in the state of Gujarat in northwestern India in 2013. And I've been able to watch as Abhiyant has worked as a public health researcher and practitioner with both the Public Health Foundation of India, as well as with the Natural Resources Defense Council since then. And so I'm really thrilled to hand over the program to Abhiyant for the first segment of this webinar to share some of his experience with this issue of extreme heat and health in India. So Abhiyant, I'll turn it over to you.
Well, thank you. Thank you so much, Amrita. That was a great recall of our shared fond memories of working together in India. So yeah, I hope my screen is visible and I'm
Yes,
audible.
yes, we're able to see you and hear you, and also your screen.
So once again, thank you so much to you, and of course to the Boston University and HSPH for organizing this CAFE RCC webinar. And I'm glad that this particular event is happening at a very apt time when um, India is again facing its second spell of extreme heat event in this summer season, mostly in the northern and northwest part of the India. I'll just be, speaking some of the basics, how the entire heat planning in India started and what are the challenges that we are facing, particularly in the early warning system, which is a part of the heat action planning. And then I'll hand it over to you, to share about our latest research on how the heat impacts health and how, research can advance the heat health early warning systems. So we all know, like, climate is an average weather conditions over a time, and global warming refers to an average increase in the Earth's average temperature. This is a good resource. I'm sure most of our participants have already used it, but if not, then you can go and see, what is the average increase that your particular local place have experienced or have gone through over a period of time. If you use the link that is there available in this resource. So I come from India, and in India I come from the one of the western states in India which has very dry and arid climate, Gujarat. And this is the trend of warming that my particular state has experienced over a period of time. But then this small changes in the average period or average temperature, uh, how does that impacts the big extremes? So earlier, when we had this average temperature, we had equally distributed extreme cold, heat, and extreme heat days. But now, since our, average temperature is shifting towards the high temperature ranges, we are now facing more heat and extreme heat days, and not just extreme heat events, but other, extreme weather events as well. For example, wildfire. We have seen a lot of events of wildfires, not just in India and Australia and US and other places as well. Sea level rise, it's rising at much faster pace, and causing a lot of migration issues. Floods, particularly the urban floods, because of the torrential rainfalls. This particularly basically is a picture from Patna, one of the eastern states in India, and this is from a hospital. So now imagine, during a climate crisis or an extreme weather event, or in any accidental situation, people require the access to the healthcare facilities. But if this is the situation of the healthcare facility itself, then how terrible it could be. And of course, rise in the average temperatures and extreme weather events, extreme heat spells, intense and more frequent heat spells. So how does heat impacts? It impacts two ways: directly and indirectly. The direct impacts, we all know, the heat illnesses, where the direct impacts are dehydration, heat cramps, heat strokes, heat exhaustion, which we call classical heat wave or heat related illnesses. But it also exaggerates the hospitalization rate. So what we see as a classical heat stroke, exertional heat stroke illnesses or conditions, is just the tip of the iceberg. What burdens the health system more is the indirect impact of heat on the system. For example, people with comorbidities, people with underlying health conditions, people at extremes of age, the underlying conditions get exaggerated, and they have to end up being in hospital. And we see an average increase in the OPDs, in the average increase in the emergency calls, in the emergency visits, and that increases the burden on the health system and hospitalization. Not just that, we also see impact of heat on infrastructure. We have started seeing that very recently. Impact on the power sector, impact on the transport sector, and many others. So these are some of the ways how heat impacts directly and indirectly on our economic systems together. As I just mentioned, heat is not just affecting the health, but it is also affecting the livelihood of the people. So this is one of the reports from Lancet, where the potential hours of billions of potential hours were lost because of the exposure to the extreme heat. And most of these happened in the low and medium income countries. And again, in which of those sectors it has affected the most? In sectors like agriculture, for example, India is majorly agriculture, economy. So it has impacted a lot to India in past few decades. Even if we talk about heat, if we take heat or heat waves as disasters, then if I go by the last 2 decades, which were the top 10 deadliest disasters, heat still stands out among the top 10 disasters. For example, the European heat wave in 2003, which accounted for more than 70,000 lives, and in Russia, which accounted for more than 50,000 lives. Even in India in 2015, heat wave and in Karachi, together, both these countries had accounted, heat wave of 2015 accounted for more than 3,500 deaths across these two countries. And these are official numbers, but as I said, these are just tip of the iceberg. And what the current, Lancet report and projections said, the latest one said, is that there is possibility of more than 370% increase in the heat-related deaths by mid of this century, under the scenario of 2% a year, 2 degrees Celsius warming. We have heard about this code red for health, era of boiling, era of global boiling, global warming is over, and we are into the era of global boiling from the Secretary General of UN. But is it now that the era of global boiling has arrived, or code red for health has arrived because of climate change? No, I think what we have already seen, for example, this picture. This is from, again, 2015 heat wave in India. Uh, this is uh, uh, this is a picture from Delhi, right outside Ames Hospital, as reported by the media. Uh, Imagine if a tarmac road can melt because of the heat, because of the temperature. How would it not affect the health of the people, right? So this was the situation that we have seen, and even horrific situations again in the same year in 2015 happened in Karachi. Uh, this is a picture from one of the morgues in Karachi, which we can clearly see was running out of the space for the dead bodies. The deaths that happened because of the extreme heat conditions that occurred in the early part of the June in 2015 in Karachi. And the mortuaries and morgues have to put out such kind of signages right outside, their doors, that sorry, they are running out of space. This is a real picture, by the way. So again, coming back to the place I come from and from where all this work in India started. So I come from the city of Ahmedabad, which is again in the western state called Gujarat in India. Summers for us were also not different. I and Amruta had a chance to work on these initial days. So earlier, all the news stories used to be like this. We used to get reporting of the consequences of events, the extreme heat events or extreme, or heat wave spells, but not reporting of the preparedness from the city or authorities, like what they are doing or what citizens should do. There was no preparedness kind of information available, but in the news stories also, it was all about what mishaps has already happened, if we go by the news stories. In 2010, in the month of May, this is what triggered India's heat adaptation planning. What happened in 2010 May? There was an extreme heat spell in the last in the last 2 weeks of the May, particularly starting from 19th May till 5th May, we saw an increase in the average mortality, all-cause mortality in the city that was getting reported. And then that was the same time when we also saw an increase in the average daily maximum temperature in the city. And when then we correlated that with the average of 2009, same month, May month of 2009, and 11, all-cause deaths, daily all-cause deaths, and daily maximum temperature, we found that there was a significant increase between this particular period. So if I talk about this particular week, there were more than 800 deaths happen in that particular week when the temperature was hovering more than 44, 45 degrees Celsius throughout those, 5, 6 days. And if I talk about the entire month, which was unusually very hot comparing to other years during the same period, there was more than 1,344 excess deaths that occurred in that particular month. And this wasn't just the scenario with the all-cause death. It was also a scenario with the average increase in the emergency ambulance call. We saw an increase in the average emergency call during same period as well. And, when we examined, was there any other, major epidemic or outbreak or any other major accident that happened in city? There wasn't. It was only the heat wave condition that occurred or that happened during this period, and that is when we observed this increase in the average mortality. And this became the genesis of development of the first South Asian citywide comprehensive heat action plan for the city of Ahmedabad, developed together by the local municipal corporation and the local knowledge technical partners, for example, the Indian Institute of Public Health, the Public Health Foundation of India, and the international expertise, for example, the Natural Resources Defense Council, where I am currently working with. The plan had very simple, tailor-made solutions, for example, early warning system and interagency response plan, public awareness and community outreach, capacity building for medical professionals, and what are the measures that could be taken to reduce the heat exposure and promote the adaptive measures among the communities. If I talk about the early warning system and interagency coordination, there was a proper plan made that how the alerts and warnings will come from the meteorology department to the designated nodal officer in the department. So, for example, in case of Ahmedabad Heat Action Plan, the health department was designated as the nodal department, and there was a designated nodal officer who looks after the entire plan. So that person receives the warnings and alerts from the meteorology department, and then he disseminates it to all the key stakeholders and the departments, to the press, to ensure that it reaches out to all the essential and key departments and communities. Second component, public awareness and community outreach. So when I say public awareness, it is general public awareness, letting people know what are the do's and don'ts, what are the know-hows of heat. So this awareness goes around throughout the summer season through different means, through public displays, hoardings, through miking, honkings, through digital displays, through radio jingles, through various means. But then when we talk about community outreach, we are talking about the targeted communities, the vulnerable communities. For example, on the right side pictures, if you see, we conduct targeted workshops for the vulnerable communities, like traffic policemen who are exposed to the outdoor heat because of the nature of their work, the street vendors, the women street vendors, particularly the slum women. So reaching out to those targeted communities with tailor-made solutions and messages for them. Again, these are some of those examples that I was talking about of community outreach. And not just that, also ensuring that we all know about the CAB, the Common Alerting Protocol. So making sure that alerts are reaching out to majority of or most of the public, most of the communities and citizens through bulk messaging as well. Then third component, building the capacity, which is very essential, and capacity particularly of the those departments or those stakeholders who are in the front line of dealing with the issue. For example, health department. So building the capacity of the health department, conducting, tailor-made trainings and workshops from them to help them understand how to differentially diagnose heat related illnesses, what are the correct treatment protocols, and how to equip the health facilities to deal with any imminent extreme heat spells, and not just health department but other key departments also, and also reaching out to the to the grassroots level health workers through trainings at the grassroots level. So these are some of those examples, where we reached out to the grassroots health workers through telecommunication, through television training programs, where they can attend the training and disseminate that in their communities. So after doing all this, we have seen change in this scenario. So what the news before the implementation of heat action plan was, where we were seeing the aftermaths of the heat spells or heat wave, impact of heat waves. We started seeing preparedness, news of preparedness in the media. AMC, the Ahmedabad Municipal Corporation gets ready for 3-day heat wave. Department tells cops how to beat the heat. So these kind of news have started emerging. And lately, we also added this intervention. This intervention wasn't part of the heat action plan earlier in Ahmedabad, of reducing the exposure to heat and promoting the adaptive measures, where the city encourages the community, the CSOs, the religious groups to be part of the heat action plan, encourage them to engage with the communities, whatever help they can provide. For example, this is one of the religious group offering safe drinking water at kiosks at different places in the city. And this gentleman, holding his hand, was the then mayor of the city. So many such measures had been taken, including one of which became a major program in many states and also in many cities, is called Cool Roof. So this initiative was also taken under the Ahmedabad Municipal Corporation's heat action plan, where the communities were encouraged and city supported some of the vulnerable communities in the slums to paint their, tin shaded or in some cases even asbestos roofs with the these cool reflective paints, sun reflective paints, which can help in reducing the indoor temperatures by 2 to 5 degrees Celsius and provide them the thermal comfort, and also help them in averting their energy cost for cooling during summer. So these kind of campaigns were taken, and over a period, we have seen the result of this heat action plan in terms of reduction of heat related or heat stroke cases and deaths in the city. And it wasn't just that, it was also documented and published in a peer-reviewed journal that after the implementation of heat action plan, the city was able to avoid more than 1,100 deaths, annual deaths, because of during the extreme heat days. So this was very encouraging, and taking example or taking um, knowledge from this, the plan got, the heat action plan got scaled to many states and cities and districts across the country with the support of national leaderships, the National Disaster Management Authority in India, the India Meteorology Department, and the Health and Family Welfare Department. So from one city in 2013, it got scaled to many cities and states and districts at subnational and city level in the country with the support of the national leadership. So while we had seen, increasing trend in the average heat wave deaths, average heat wave days across the country over a period, and also more and more states, getting affected because of heat wave, we have also seen an average, decrease in the number of deaths that were getting reported because of the heat. So this was so far how the heat action plan started in India from Ahmedabad, and then with the support of national leadership and departments, it got scaled to many states and cities. I'll touch upon one of the key uh, issue in the heat action plan, which is the first component of the heat action plan that I talked about, the early warning systems. Early warning systems has a very important component which is called threshold, which I believe Amruta will also talk about in her session next. So what are these thresholds? So before talking about threshold, let's talk about what is heat stress. We all talk about, I mean, we all talk about heat wave, but what is heat stress? It is a situation where too much of heat is absorbed by a person. So how much heat is too much heat? Is that what we call heat wave? Should we call heat wave is a condition where too much of heat is absorbed, or is that the heat stress? Um, well, if I talk about heat wave, in general, it's a prolonged period of abnormally hot weather condition, and there is no universal definition or threshold for heat wave. There are directions, but no universal definition, and it's a very local phenomena. For example, what happened in 2013 in Europe, where more than 70,000 people died because of heat wave, more than 18,000 people died in France itself, but the temperature was hardly hovering around 37 to 40 degrees Celsius. Whereas in India, our definition for heat wave starts at 40 degrees Celsius in the plains. So when to trigger, when to alert people is an important question, and that is what we call threshold. Uh, Again, there is no universal definition. Heat waves are very spatial phenomena. It could be regional, sub-regional, local. There could be heat wave alerts in one district, sub-regional level, national level, and may not be in the other, area. It's also a temporal phenomena. It need not to be, declared a heat wave if only one day temperature cross the threshold. It could require 2 or 3 or more days of temperature. So again, there is no one size fit for all. But what is most important is local thresholds are essential for an effective heat health early warning systems. So what are local, what is threshold? It is any thermal variable. It could be the maximum temperature, it could be the minimum temperature, it could be mean, it could be heat index, or the complex one like WBGT or UTCI. But frankly speaking, majority of the heat action plans across the world, Tmax is the most widely used variable. Uh, what are the methodologies that we can opt for to develop the thresholds for the local heat health early warning systems? The best one in my knowledge is the time series analysis, and who can do it? It could be done by the public health institutions or epidemiologists or biostatisticians working in such institutions. Things to consider while doing it: confounders, like air pollution, age, and many other. Also the acute and average effect, also about the lag effect. But in conditions like in many countries in South Asia, where you may not have the outcome variable to to correlated with the exposure variable, you may go by the percentile based values to estimate the thresholds. And this has been recommended by the WHO WMO guidance on heat wave and health early warning systems, that in situations where there is only basic meteorological information is available, but no health data is available, or quality health data is not available, you can still go by the percentile values, for example, 90th or 95th percentile, to trigger the warnings under the heat health early warning systems. And India, the India Meteorology Department has already estimated the 90th, 95th, and 98th percentile values for all meteorological stations across the India. This is one of the studies that we did for the city of Ahmedabad. We estimated the relation between the temperature and mortality, all-cause mortality, daily temperature and all-cause mortality for 31 year of data from 1987 to 2017. So we only talk about the maximum temperature, but if we also look at the minimum temperature, for example, in this particular study, what we found was that if we limited our analysis at 42 degrees Celsius maximum temperature and 28 degrees Celsius minimum temperature, um, by every 1 degree Celsius rise in the maximum temperature, the increase in the mortality risk was 9.6%, whereas by every 1 degree Celsius rise in the minimum temperature, about 28 degrees Celsius, the risk of mortality was 9.8%. So it is important to also look at the minimum temperature and not just the maximum temperature, and also other factors, humidity and many more. We also need to look at the vulnerabilities. For example, in the same study, when we examined female in general were at high risk compared to the male. People at the extremes of age, the younger children and the elderly were at high risk compared to the other age groups. And also the city is divided into 6 municipal zones, and those zones which has higher population density, and those zones, for example, central zone, which has higher population density, and those zones which has higher slum areas and industries, for example, the south zone here, as you can see in the graph, were at high risk of the mortality due to extreme heat or increase in the temperature. But when we talk about how do we set, these temperatures, as I said, Tmax is the most widely used variable, but I call it decision makers dilemma. Who will decide for a heat action plan that what should be, the what should be the thermal marker that should be used for alerting the people? Should it be Tmax? Should it be Tmin, humidity index, or WBGT? Who will take that call? So that's what I call a decision makers dilemma. Also, same goes for the in our analysis, which impact data shall we use? Shall we use the all-cause mortality, or cause specific daily mortality data, or hospital admission data, or emergency ambulance call data? Who will decide that? This is a decision makers dilemma. I believe some of us are on the chat, and I would highly encourage if you all can, let's say the Y bar is the cumulated mortality and daily mortality, and we have 3 temperature thresholds, T1, T2, and T3. If you want to set up a threshold for the local city heat health early warning system, where would you set that? At T1 or at T2 or at T3? You can answer that in chat. I just want to see some of the answers. Great. So I clearly see T2, right? Now this is only all-cause mortality and cumulative, daily all-cause mortality. Now at this point, where would you like to set it now? Would you like to set it at T1, which is 30, or T2, which is 33? See, now we are also seeing a picture of morbidity along with mortality. Morbidity because of heat rises at much earlier temperature than the mortality, right? And morbidity imposes equal burden or more burden on the health system compared to the mortality. So where would you like to set it now, at T1 or T2? So mostly I think people would prefer to put it at T1 now, right? So there is no right or wrong answer for this. I'm just saying that this is a decision maker's dilemma. There are no gold standards available, but as the science is evolving, we are getting more aware about it, and we are getting more wiser about it, and which is good. But the good part is that countries with effective early warning systems have 8 times lower mortality rates from disasters, including heat. The recent heat spells that Amrita was talking about definitely has a huge contribution from climate change. The recent one that happened in South Asia in April and early part of May was 45 times more likely because of the human-induced climate change. In fact, today, if I talk about this is what I call we are already into the global era of global boiling. The capital city of India experienced places, some of the places experienced temperatures as high as 52 degree plus Celsius. So this is beyond explanation. And for that, we need to communicate better, particularly with the authorities and also with the vulnerable communities for a better change. Yeah, so that's all from my end. Thank you so much, and I'm here to take the questions. Thank you.
Thank you so much, Abhiyant. That was really fantastic overview of the programs that you have been working on and also the health impacts of extreme heat exposure. I just want to take a quick pause to see if anyone in our audience has any questions. We have one in the chat. So Elaine has asked, what adjustments have to be incorporated into the planning in response to infectious disease outbreaks, for example, the COVID pandemic?
Well, I think the pandemic was an exceptional condition. We had seen adjustments happening during pandemic as well. Authorities did take precautionary measures, but yeah, it was an exceptional case. The pandemic was an exceptional case, so it was a challenge. We have some learnings from the pandemic. How the biggest challenge was with the healthcare workers, particularly who were, downing with the PPE kits and all that, and there were limited resources available. So that was an exceptional case, I agree. But yeah, we have some learnings and we'll be improving our plans in future if such kind of outbreaks or major epidemics happen, then what necessary measures could be taken. Yeah.
Thank you so much. I have another question, which is that you talked very briefly in your discussion about some of the different activities that were implemented as a part of these heat wave preparedness plans. In your experience for this region, what are some of the most successful measures that you've seen that have been health protective, especially keeping in mind the most vulnerable from your study, such as the elderly patients or people living in high population density areas? What are some of the interventions that you can recommend for people who may be interested in this type of work, such as, you talked about reducing exposure to extreme heat, maybe things like in Western countries, we recommend air conditioning as a primary measure for adaptation. But do you have other locally relevant health protective measures that you can recommend that you've seen working in your experience?
Yeah, absolutely. So one of the measures that I lastly mentioned about the adaptation measure, the cool loops, the such kind of passive cooling measures are cost effective and are helping in vulnerable communities in adapting with the rising heat, not just providing the thermal comfort but also helping them in saving the cost for energy for cooling. And we have seen the initial impacts and difference in the temperatures. They are also being piloted in different ways. For example, in one of our latest work with the city of Jodhpur, again in the western part of the country, in the state of Rajasthan, our partners have with the local government, city government has piloted one of its kind new net zero cooling station, which has all these facilities. And if we see the temperature difference, it was stark difference. I mean, these are all initial findings not out yet, but we have seen difference of more than 10 degrees Celsius between inside and outside the cooling stations. So these are some of the low cost, energy efficient solutions that can help the communities with in coping with the heat.
Great. We have a few more questions coming in the chat. Please feel free, if you're on the participation side, if you have any questions for Abhiyant, feel free to put them in the chat now, or we'll have another opportunity to chat towards the end of the webinar. One more question that came in. Thank you for a great presentation. Could you speak more about how we can better address climate compound events, such as heat waves that follow perhaps a major storm or a major flooding event?
A very big question, rather. So we are yet not done with the heat. I mean, we have started talking about the compounding effect of heat and heat and drought. The questioner has talked about the compound effect of heat and storm and flooding, but I'm talking about heat and drought, which are usually being compounded. So we are yet not addressing that properly, but at least we have started talking about that. I'm glad that US has recently invested in developing, establishing the heat center of excellences for heat resilience. We are trying to do something similar for India, trying to see how we can explore that for South Asia as well. So those are big questions that will be addressed in future, but as of now, we are facing the challenge of extreme heat. So I'll stick to that.
Yeah, as you said, it's a big set of questions. And then last but not least, we have a question from Caleb, who asks, have the heat plans been designed and implemented to your preference? Is there anything that you had hoped for that didn't make it into these heat action plans, either because of funding or because of competing interests, or maybe because of complexity?
I would say because of all these three reasons, and that's what we are trying to address. Heat is not a notified disaster, neither by the disaster, authorities or by the health authorities, neither in India, not in US. But we are trying to make, ways to make them more institutionalized, decentralized, it has to be, I mean, risk, be it heat risk or any other disaster risk. Risks, are global, but resilience is local. The solution has to come from local level. So local authorities need to, institutionalize it and make it their own initiative, heat action plans. So they have to and they have to be what the national authorities and subnational authorities need to provide is the institutional mechanism of funding of policies and measures, so that the local authorities can accept it and institutionalize it. So yeah, these complexities are there, but we are trying to address this.
Wonderful. So I think that maybe concludes some of the questions that we've received up until now. I just want to encourage anyone who's participating to please feel free to continue putting your questions in the chat. So thank you again so much, Abhiyant, for joining us for this webinar. If you are able to stay on with us, would love to have you for the second part of the webinar, and also in case we have other additional questions that our participants would like to send for you over the course of the next few minutes. So now I'll transition over to the second part of our talk for today, where I'll be focusing in on some of the research that's been done to date, looking at the relationship between extreme heat and morbidity and mortality across India, as well as talking about some of the different knowledge gaps in our understanding of this relationship. So just to quickly share my disclosures, I do have some institutional funding, but no other disclosures or competing interests to share. So as we've learned in spades from the discussion with Abhiyant and also from some of the work that he's shared, extreme heat is a recognized threat to public health. We know that extreme heat can, an exposure to higher ambient temperatures can lead to both illness as well as death. Some of the different outcomes that Abhiyant shared during his talk include heat stress, heat rash, swelling that's associated with heat exposure, heat exhaustion, and heat stroke, which can potentially be fatal. And one of the things that I want to mention here is that one of the challenges that we face on the public health side is that from a clinician perspective, it can be very difficult to ascertain whether a patient has been exposed to extreme heat or whether they're experiencing some other type of physiological outcome. So for example, patients who present to different hospitals with heat stroke look very similar to patients who are presenting to the hospital with a regular stroke. So for example, some of the slurred speech, blurred vision, dehydration, et cetera, those can be signs of a regular stroke in addition to being signs of a heat stroke. So without understanding the underlying exposure piece of the equation, it can be really difficult for clinicians to understand what their patients are facing. But in addition to these direct effects of heat exposure, exposure to heat can also cause stress on underlying physiological systems, which can exacerbate people's existing medical conditions. So we've seen things like increases in the rates of renal insufficiency, cerebrovascular diseases, exacerbations of pulmonary illness. And then in addition, I want to focus on some of the different systemic issues which have been coming to the forefront in our recent discussions about the impacts of extreme heat exposure. So things like access to school, changes to care schedules, maybe also changes to occupational exposures as a result of increasing temperatures. So there are a lot of different public health components of this exposure to extreme heat. And I want to talk also a little bit about urbanization, because urbanization and rapid urbanization that's happening over the course of the last few decades has really striking implications for extreme heat exposure. Abhiyant was mentioning during his talk that sometimes we see temperatures that are a few degrees centigrade higher in cities compared with surrounding environments. So we know that today up to a little over half of the global population lives in urban areas, and this is expected to increase to 68% by 2050. And we know that rapid urbanization leads to a lot of economic growth and opportunity, but also exacerbates issues like poverty, income inequality, and also adverse health outcomes that are associated with environmental exposures. And one of the things that I want to highlight, this is from the UN Department for Economics, and they show growth rates of urban agglomerations across the world by size class. And what we can see is that a lot of the growth in urbanization that's happening around the world is concentrated in some of the areas like South Asia, East Asia, Sub-Saharan Africa, where we do anticipate seeing increases in the summertime temperatures and increasing periods of extreme heat that are more frequent, but also lasting longer and are more intense as well. So extreme heat, urbanization, and climate change are very inextricably linked together. We know that cities and urban areas experience higher levels of heat exposure than surrounding rural areas because of the urban heat island effect. We saw evidence of that in some of the work that Abhiyant presented earlier, as well as changes in urban microclimates and reduced diurnal variation. So diurnal variation describes the difference between the daily maximum temperature and the daily minimum temperature. And we know that both of these temperature estimates have implications for health outcomes. And climate change is expected to just increase the frequency and severity of extreme heat. So we know a lot about the relationship between extreme heat and health outcomes in a variety of different contexts, but actually relatively few studies have assessed the relationship between environmental exposures and health outcomes across multiple cities in India. And India represents a very unique opportunity for this research because populations across these cities in India sit at the intersection of extreme environmental exposures, including very extreme heat conditions as we're seeing today, as well as very, very massive urban populations with some of the largest megacities of the world in India. And this also, as we've seen, can exacerbate some of the vulnerabilities that people may face as they're continuing to be exposed to these environmental conditions. So India presents very unique challenges for public health research, but also the implementation of these different research activities and some of these different heat adaptation plans can also have a correspondingly huge benefit for population health across these communities. A lot of the previous work that's been done relies on exposure response functions that have been developed in more high income country settings, such as looking at Europe across the 2003 heat wave, or studies across the US across various heat wave periods. These studies are more plentiful. They're a little bit more easy to implement because of existing data resources in these other areas. But I think that there are limitations of extrapolating that work to places like India, where the environmental exposures are more extreme. The types of vulnerable populations who are at risk may be different compared to Western countries or more high-income country settings. So I think that there are a lot of challenges for taking research that's been done in other places and applying that research in places like India. And that has implications both for how we conduct these studies, as well as how we design some of these different interventions in order to make sure that we're being health protective for local populations. But another thing that I want to highlight is that the research that we can conduct in India has potential opportunities to inform the policies in other parts of the world. So as climate continues to warm across the globe, we may be seeing extreme temperatures, such as what India is already experiencing, in other places that are currently at higher latitudes where they don't already experience baseline temperatures at this level. So I think this work is really important, both for how it can protect vulnerable populations in India, as well as for how it might help us to inform ongoing work in other parts of the world that might see similar temperatures in the future. Some of the challenges for this heat wave research Abhiyant has talked about, including the fact that we do not have a consistent definition for what a heat wave actually is. Usually it's some combination of a temperature threshold, which can be a percentile or an absolute temperature, as we've seen, and then also some duration. So does the temperature get high, and does it stay high for at least a couple of days? And that's how we generally declare heat waves. But that is very spatially heterogeneous, depending on the location, depending on the baseline temperatures that people experience, and also depending on the policy relevant work that's already been done in the region. From the outcome side, it can be very difficult to estimate heat wave associated morbidity and mortality. So what is the correct outcome that we want to look at in order to understand the health impacts of extreme heat? Should we look at all-cause morbidity and mortality? Should we look at specific health outcomes? If we're focused on mortality, should we look at accidental versus non-accidental deaths? And so these are some of the different challenges just before we've even started to talk about the availability of data resources in the region. And one of the questions that I've often been asked is, it's already very hot in India. Aren't people in India already used to the extreme temperatures? So what is the role that adaptation can play in our understanding of the relationship between extreme heat and health? So I want to talk a little bit about some of the early research that looked at the burden of heat mortality across the country. This is a publication from 2000 that looked at the relationship between extreme heat wave periods and mortality outcomes across the entire country of India. And you can see that this is from so these estimates are from the National Disaster Management Authority. This was some of the early work looking at the overall burden of extreme heat for mortality across the country. And just to provide you with some baseline, as of the 2001 census, the population of India was about 1 billion people. So the overall understanding early on is that extreme heat is relatively a low threat for populations across the country. We're seeing, in a very extreme summertime period, which happened in 1998, there were 33 extreme heat spells that were estimated across the country, contributing approximately 1,500 mortalities associated with those extreme heat periods. So compared to the baseline population of 1 billion people, seems like this is a very minute threat. However, early on, a lot of researchers were assuming, especially in this Ahmedabad heat action plan development, that this was likely to be an underestimate because the NDMA was receiving information based on news media reports of mortalities that were happening during heat waves. And as we've talked about, it can be really challenging to actually understand the burden of illness that's associated with extreme heat, because a lot of people may present with different types of illnesses, and unless you understand what their exposure pattern was like before they presented to the hospital or before they passed away, it can be very difficult to quantify the heat-related mortality without that exposure survey. So this is a study that Abhiyant worked on along with some colleagues that has updated some of the understanding of mortalities associated as well as morbidities associated with extreme heat exposure. This is showing updated information through 2021 of the estimate burden of heat mortality associated with different types of outcomes. And so what we can see is that through time, our assessment of the burden of heat-related illness has changed as our understanding of specific illnesses that are associated with extreme heat exposure has been updated. And Abhiyant mentioned this study looking at one specific heat wave period in one specific city. So this is from the May 2010 heat wave in Ahmedabad, which contributed to some of the early work developing heat action plans and preparedness for the region. And, comparing to some of the previous work, if we look back a few slides, so in one extreme heat summertime period, estimating 1,500 mortalities across an entire summer in 1998 for the whole country of India, and then looking in one particular heat wave period, estimating 800 deaths during 1 week of one heat wave in one city, we can get a sense of potentially how much we're underestimating the burden of illness that's associated with extreme heat. So this led to a lot of work to develop and implement this heat action plan for the city of Ahmedabad. A few other examples of interventions that were implemented as a part of this effort, including focus group discussions with clinicians in the city, the implementation of different posters and hoardings, both in English as well as in Gujarati, in order to inform different populations how they could protect themselves from extreme heat, as well as, Abhiyant mentioned some of these locally protective measures such as cool roof projects and evaporative cooling from clay pots, which is a very locally relevant cooling measure. And then there was this heat action plan in 2013, which was the first of its kind in South Asia, has been renewed, and Abhiyant has talked about some of the work that's been followed on from this original heat action plan, including the replication in other cities and states in India. So just kind of an overview of where the research fits in with some of the policy work. So, following up from the initial policy work in Ahmedabad, some of my interest was looking at, can we assess the impact of extreme heat on mortality across different communities in the region? And so early on in my own research, I was able to collect registry data from across different communities in Gujarat as well as Rajasthan. So in India, cities are required to report on both births and deaths under the Civil Registration Act of 1952. However, those data resources are not initially being prepared for the purpose of facilitating these types of public health or epidemiologic analyses, which is one of the challenges that Abhiyant did mention. What types of data resources are available for biostatisticians and for epidemiologists in order to try and assess the relationship between extreme heat and health outcomes. So these data were available through different registration facilities across the region. However, it did require some effort to collect these data, clean them, prepare them. A lot of collaboration with local municipal corporations went into the process of collecting this information. And one of the things that I want to mention here is that it's very clear to see this is looking at daily maximum temperature and relative risk of mortality for 4 different communities across this Western India region: Jaipur, Churu, Idhar and Himatnagar, and also Mumbai. And what we see is that there's a very clear increase in the risk of mortality as temperatures are increasing for each of these communities. Although for Idhar and Himatnagar, which are smaller communities in northeastern Gujarat, it's a little bit harder to see the clarity of that relationship given the smaller population size. But what's very apparent from this type of work is that while it may be true that in the region, local communities are well adapted to extreme heat, having experienced periods of extreme heat historically, there are some temperatures beyond which it just becomes very difficult for local communities to survive and thrive. Once we cross the 40-degree temperature threshold and even the 45-degree temperature threshold in the region, we see that there are dramatic increases in the relative risk of mortality, even in these places which are already well suited to experiencing extreme heat. So while adaptation can play a role, as climate continues to warm, communities will continue to face these extreme conditions to which they're just not well suited. We did see increased risks of extreme heat looking at specific heat wave definitions as well. So in this early work, I was focused on one particular definition of extreme heat, which is the 97th percentile of the local temperature record for at least 2 consecutive days. So this is comparing extreme heat wave days with non-heat wave days, and we see a dramatic increase in the risk of mortality on heat wave days compared with non-heat wave days, particularly in these very northern communities in Jaipur and Churu, where we see up to sometimes a 30% increase in the risk of mortality on heat wave days compared with non-heat wave days. We can look a little bit more in detail at what heat waves might look like in order to try and understand the characteristics of these heat waves across these different communities. And this is really important because it can highlight that so each of these communities experiences a variety of different heat wave periods that are differing in intensity, which is shown in the changes from yellow to dark red in the coloration of each box. The width of the box represents the length of the heat wave period. And the timing and season is shown with earlier heat waves further to the left of the figure and later in season heat waves further to the right of the figure. And what we can see is that there's a wide range of heat wave intensities across the years, as well as timing and season of different heat waves occurring in different communities. An important example to pull out here is places like Mumbai experience multiple heat wave seasons within 1 year, with an early pre-monsoon heat wave season happening earlier in the year as early as February, and then a later post-monsoon heat wave season occurring after the monsoon rains have receded in the region as late as October of the same year. And this is really important because it speaks to some of the other characteristics that Abhiyant mentioned that are really important to take into consideration as potential confounders. So in Mumbai, for example, relative humidity may be very important. It's hard to know if the earlier heat wave periods are more deleterious to human health without accounting for the fact that the relative humidity will be very different before the monsoon rains hit compared with after the monsoon rains recede. So it just speaks to the importance of looking at individual heat wave periods specifically, as well as the importance of research that looks at multiple heat waves in multiple parts of the region as a whole. And we did see some evidence of effect modification by heat wave characteristics, looking at as heat waves become more intense, how do they impact health? As heat waves become longer, how do they impact health? And as heat waves change in terms of their timing and season, how do they impact health? And focusing in on the example of Mumbai, once again, we saw that heat waves that were later in the season were actually more damaging for human health, which is very different from some of the work that we've seen in the US and Europe, where the first heat wave every year is the most damaging. And we think that this is because of an effect that's known as mortality displacement, where people who would have passed away during a summer happen to pass away during the first heat wave because they were already the most vulnerable. And so the effect of the first heat wave each year is the strongest, and then the effect kind of tapers off as people experience additional heat waves each year. And we see the opposite of that in some of these communities in India. So as the heat wave season continues, the later heat waves become more and more damaging. So this indicates that there's something about these populations that is really important, where heat waves become more deleterious for health as the heat wave season progresses. So just again, highlighting the importance of local research to inform these local adaptation strategies. So far, I've only looked at one or maybe two heat wave definitions, but there are a lot of different ways that we could define a heat wave, which includes this combination of how intense is the heat wave, what is the temperature threshold, as well as how long does the heat wave exist, or how long does the heat wave persist, how many days is that temperature threshold met. And I think one of the things that's important to point out here is that in doing research and studies in places like India, we will see heat waves that are at the 97.5 percentile of temperature. So that kind of equates to the 3 or 4 hottest days of every summer. And these heat waves will last for at least 4 days in duration. So this is a very, very extremely hot period that's lasting for a relatively long period of time. So in order to look at the relationship between extreme heat across all of these different potential heat wave definitions, we compared matched heat wave days to their nearest neighbor non-heat wave day based on a variety of different potential confounders, including things like relative humidity, air pollution exposure, et cetera, to estimate the risk ratio for each heat wave definition for each of these communities in Western India. In addition to estimating the relative risk for each heat wave definition, we were also interested in looking at the attributable mortality. So what is the attributable number of deaths that are occurring for each of these heat wave definitions and each of these communities? And what we found in this study was actually quite interesting. So I know that there's a lot of different components to this figure, so I just want to zoom in to the city of Jaipur in the state of Rajasthan. So the figure on the left shows the number of attributable deaths per year that are happening under each of these different heat wave definitions. And the figure on the right shows the relative risk of mortality. So the classic epidemiologic estimate of relative risk. And what we see in this analysis is that there are some heat wave definitions that have a very high relative risk estimate, meaning that if they occur, they are going to be very problematic for human health. However, they happen so relatively infrequently in this data set that from an attributable mortalities perspective, they're not actually that big of a burden to the health outcomes. So I'm going to reframe this discussion in a slightly different way, looking at the number of heat wave days that are happening per year under each of these different heat wave definitions and the population adjusted attributable mortality for each of these different cities. So the cities in this data set range from Mumbai with a very large population all the way to communities in Gujarat, such as Idhar and Himatnagar, where the population sizes are relatively small. So by population adjusting the number of mortalities, we can do a direct comparison of the risk or attributable fraction of mortality for each of these different communities. And what we see is that, once again, from a policy relevant perspective, there are changes that we can make in the definition of the threshold criteria for declaring a heat wave. So the stringency of the number of days and the temperature threshold for a heat wave definition that have a corresponding small impact on our estimates of the attributable fraction or attributable mortalities. So once again, zooming in on the city of Jaipur, which I mentioned earlier, we can see 3 different heat wave definitions that are circled, changing in stringency from about the 90th percentile of temperature for just 2 days of extreme heat to about the 95th percentile of temperature for just 2 days of extreme heat. And what we see is that when we use the less stringent heat wave definition, there's over 35 days in one particular year that's being declared as a heat wave. So this is over a month of days that are declared as heat wave, where all of the corresponding extreme heat preparedness measures need to be implemented. And by comparison, if we look at the more stringent heat wave definition of the 95th percentile of temperature for at least 2 days, we've cut the number of days per summertime that are being declared as a heat wave in about half. So all of the different resources that need to be implemented in order to create heat adaptation plans or create extreme heat preparedness, they're only being implemented for about 17 days every year as compared with 35 to 36 days every year. But the interesting thing that we found is that by changing these heat wave definitions, we didn't see that much of a change in the corresponding attributable mortalities. So maybe there are these trade-offs that need to be taken into consideration for the implementation of interventions where expanding our definition of a heat wave doesn't necessarily mean that we're being as health protective as possible. It may be more health protective to conserve the resources that we need for those hotter days where we expect to see most of the population health risks occurring. So some of this research is ongoing. I just want to mention that there have been additional efforts to look at a variety of different heat wave definitions, again, looking at the estimates of mortality risk associated with heat waves in different cities across India. This is work that was published a little bit earlier this year, which illustrates that a couple of different takeaways, I think. First of all, that there's still debate and discussion, which hopefully was highlighted also during Abhiyant's talk, about what is the right definition of a heat wave, what is the way that we can protect health by deciding on the criteria that need to be implemented in these heat adaptation plans and strategies. And also that our perceptions of the risk of extreme heat are relatively similar across time. So this is 10 years on, using additional data, expanding to multiple additional cities across the country, and we're still seeing these elevated risks of mortality associated with extreme heat exposures. We're also seeing similarly increases in attributable deaths across different heat wave definitions, although once again, our understanding of which are the most problematic extreme heat wave definitions is continuing to evolve. And it may be that there is still a trade-off to be had between the number of heat wave days per year and the attributable mortalities by heat wave definition. I also just want to mention that there's a collaboration that I'm a part of, which is the Chair India project, which is looking at developing estimates of temperature based on modeled estimates of temperature based on some of the ground data that Abhiyant mentioned from the Indian Meteorological Department, plus other land use characteristics and other types of information in order to estimate at higher spatial and temporal resolutions some of the exposures that people experience. So this is showing temperature for the year 2020 across the country of India by district, just showing some of the different gradients that we'll see in extreme temperatures across the entire country. But this speaks to some of the opportunities for ongoing research in the region, as well as the challenges that researchers do face when trying to understand the relationship between extreme heat exposures and health outcomes across the country. So one of the things that I think has remained a gap is that it's difficult to obtain high resolution estimates of exposures to extreme heat across India. Now, this is starting to evolve with a variety of different projects that are coming online, but the urban heat island still presents a huge challenge. And in order to get a complete picture of the relationship between extreme heat and health, particularly in some of these largest cities across India, we really need high spatial and temporal resolution exposure estimates so that we know where people are being exposed and what the temperatures, realistically, what the temperatures are that they are experiencing. There are also a lot of opportunities to expand and look at additional health and other outcomes that are associated with extreme heat exposure beyond just mortalities. Abhiyant mentioned emergency department visits. That could be a very important set of data in order to start some surveillance programs to look at what are the potential surges and the need for care that people might experience during extreme heat waves. There's also a lot of research being done in other contexts to look at the mental health impacts of extreme heat. So it's not just physical health outcomes associated with climate exposures and extreme heat exposures. There are also strong mental health impacts associated with these exposures. There's been some evidence in different communities across the world of increases in violence that are associated with extreme heat exposures. So I think that's another area of work that could benefit from better exposure estimation and a broader suite of health and other outcomes as they become available. And one of the things that we did mention has been documented is that extreme heat is very restrictive for children, for school, for childcare. And so learning outcomes and developmental delays may be another very important area of research. And I find that a lot of policy and intervention specifically can be driven when we're looking at children's health. So I think documenting the impact on children specifically is very, very important in order to motivate those policy changes that we need. A lot of the work that I've focused on, a lot of the intervention work that Abhiyant has mentioned is really focused on urban health. But I think there's also a huge gap looking at rural health outcomes that are associated with extreme heat exposure. And there are a lot of challenges to estimating rural health impacts of different environmental stressors in India. There's a lack of access to very high quality mortality and morbidity data outside of cities. And this is a challenge that I think a lot of different countries and communities face around the world. And we do know that urban populations are increasing, but we also know that rural communities face their own unique problems associated with climate exposures and particularly extreme heat. So I think this is another really important challenge that we as researchers and as a public health community need to address. But I think that it also speaks to potential for development of electronic health records and other databases that can be really important for addressing these climate change challenges and also especially understanding the health impacts of climate exposures. One of the things that we mentioned in the earlier session that I just want to come back to is that extreme heat very rarely occurs in isolation. So researchers have started and need to continue grappling with the co-occurrence of different types of climate hazards. Extreme heat co-occurs with wildfires, also co-occurs with air pollution, co-occurs with drought, which is really important in water scarce environments, both across India and around the world. And so looking at the public health implications of multiple challenges that people face is going to be increasingly important as these conditions become more extreme. And then finally, how do we translate all of this research that we're developing and working on into further action in order to best prepare communities that are the most vulnerable to extreme heat? And how do we make sure that the research translation efforts are inclusive of different communities taking their perspectives into consideration and making sure that there is broad agreement on the best practices and the best solutions? I think this is a very important component of the public health research efforts. So I just want to mention that all of this work was a huge collaboration across collaborators in India, in different, the Ahmedabad Climate Group, which includes some of the collaborators that Abhiyant mentioned, as well as the Indian Institute of Public Health Foundation of India. The Hyala Seksaria Institute of Public Health was also very crucial collaborators for the data in Mumbai, and the municipal corporations that shared their data resources at the early stages of this research that I've shared today. I'm also very grateful for the Chair India Consortium, which is continuing to map some of the environmental stressors that we experience across this region. And I also want to mention the entire CAFÉ team, which is putting together these different webinars and pulling together a lot of different resources for our community of practice and also for researchers across the globe. And once again, wanted to share for anyone who's interested, please connect with us through CAFÉ. You can join our ongoing discussions, get access to a lot of the different information that we are trying to provide to researchers who are interested in climate impacts on health in different communities locally and globally, and also to learn about additional webinars that we have coming up for CAFÉ University. So with that, I will say thank you for all of our participation. And I'm going to stop sharing now. Happy to take any questions either for myself or for Abhiyant as well. All right. I think that I don't see any comments or questions coming into the chat window. So I think we'll wrap up for our program for today. As Elaine mentioned, the recording of this talk is going to be available on our CAFÉ website in the coming days. So I just want to say thank you so much to everyone who joined us for the webinar today. Especially thank you to Abhiyant for giving such an informative talk about the state of the science and the state of the evidence and interventions in India to try and reduce the health impacts of extreme heat. And I just want to encourage everyone to continue reaching out for more information about webinars that we'll be hosting through CAFÉ in the future. And please feel free to join our community of practice through our website if you're interested to connect with us further. So thank you, everyone.